Good morning and welcome to the AANMC webinar on Defeating Depression, a Holistic Approach with Dr. Bjorndal. We will be starting in about 2 minutes. Good morning and welcome to our AANMC webinar, Defeating Depression, a Holistic Approach. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and we will be starting the webinar. But I'd like to introduce our speaker today, and Dr. Bjorndal, if you can just go to the second slide. Just a little bit of housekeeping.
It's not there.
Oh, it's not there. Okay, so we will, so all attendees are going to be in listen only mode, and we will be recording this. So if you miss something or there's something that you want to come back to later on, you can. We'll be sending it out to all attendees. Please use the Q&A box, not the chat box, but the Q&A section for questions. We'll be taking questions after the presentation is over. And so with that, I'm going to introduce our speaker. Dr. Bjorndal is an authority on the treatment of mental illnesses such as depression, anxiety, bipolar disorders, and eating disorders. Having overcome her own mental health challenges, Dr. Chris is a really gifted speaker and writer who loves to share her philosophy on wellness with many types of icons like Jenny McCarthy and many others. And so Dr. Chris has helped patients achieve physical, mental, emotional, and spiritual well-being. She's authored 4 books on mental health, as well as taught a 10-week course and in-person retreats on mental health. She's a graduate of CCNM, and I'm very excited to have her with us today. So she's joining us from Canada, and so please give a warm welcome to Dr. Bjorndal. I'm going to make my face and my video, all that, go away.
So thank you for having me, and thank you for joining and listening in. I'm just going to mention that I haven't always been a naturopathic doctor, and it's really through my own journey with dealing with my mental health that I've ended up becoming one. So just briefly, I'll mention that I have had an eating disorder that started in high school, and then in university, I experienced anxiety and depression. I was prescribed medication for that. And a few months after taking that, I experienced a psychotic manic event. So then I was diagnosed with bipolar disorder type 1. And really what I did with that was I really put it as far away from me as possible. I felt a lot of stigma and a lot of shame around that particular label. So what I did is I just continued wearing this mask that I'm okay on the outside, but I'm actually not doing that well on the inside. And I continued marching forward in the world, struggling, but not really telling people what was happening. I ended up having a suicide attempt that left me with kidney failure. Eventually my kidneys did recover. And I look at that as my spiritual crisis, if you will. That was the turning point for me to figure out another way to navigate my mental health. So I ended up learning about naturopathic medicine, and I started seeing both a naturopathic doctor as well as a nutritionally oriented psychiatrist. He was considered an orthomolecular doctor, and I started his protocol, and as well as the nutrients that the naturopathic doctor had prescribed. And then I had my first year where I was free from depression and anxiety. And I hadn't felt that or had that in the 15 years prior. So I knew that there was something to this. And I eventually made a career change. I went back to high school when I was 33 to get the science prerequisites to then go to the Canadian College of Naturopathic Medicine. So now that's what I do primarily in my practice, is I support people in helping them regain their mental health. So mental health is, I think, in a big crisis situation. It's the leading cause of disability in the United States for people between the ages of 15 to 44. And it affects more than 17 million Americans, which is about 7% of the US population. And despite mental health concerns being on the rise, there is no research or money being put towards figuring out how to help mental health. And a staggering statistic is approximately 50,000 people commit suicide every year in the United States. And an even more staggering statistic I heard Dr. Greenblatt say is that by the year 2030, so that's only 10 years from now, a person will commit suicide globally every second. So we have a big role to play here in naturopathic medicine. There's a lot that we can do to help support people, which I'll talk about today. So I'm going to go through some diet points and supplements that help support mental health. And then I'm going to talk about the framework that I use with patients and teach you a practical tool to use to help navigate your mental health, the thoughts that you might have. And then I'll go through a patient case study. So first, I want you to understand that everything you put in your body informs your body in one way or another. So it's either supporting you or it's not serving you. And the food that we eat affects how our brain functions. So you have to put the right gas in the car, so to speak. In order for you to feel good, you have to fuel yourself properly. And if your diet consists of a lot of sugar and processed foods and junk food, understand that this can be a root cause for the suffering and the mental health challenges that you're having. And the neurotransmitters and hormones that we make regulate our behavior and are directly linked to our mood. So this is the main neurotransmitter that people often talk about when it comes to depression and anxiety. This is the serotonin pathway in the body. And what I want you to understand here is that first and foremost, tryptophan is the precursor to forming serotonin. So, and the key with tryptophan is you can't make it. Nobody can make tryptophan. And in order to get to serotonin, you have to have sufficient levels of tryptophan in your body. So tryptophan is what's called an essential, keyword, essential amino acid. And there's other nutrients that are also essential. So that word means you can't make them yourself. You have to get it from your diet. And this was so key in my recovery. So I was started on several of the nutrients that you see listed here. And as I mentioned, I carried those along. Well, actually, I didn't mention this yet. I carried those nutrients along with the pharmaceutical medications that I was taking. And at that time, when I started with this approach, I was taking 5 psychotropic medications. So, but the key I want you to understand is we also need to we don't want to necessarily be supplementing ourselves to death. We want to be eating properly and eating these essential nutrients. Now, the other points to mention about this pathway is if you are under a lot of stress, then tryptophan will go down a different pathway in the body to form something called quinolinic acid, and you will not get to serotonin. So in terms of the food, we always want to use food first. We want to be focusing on those tryptophan forming foods, foods that are high in B6, and foods that also are high in omega-3s. Many people are deficient in omega-3s. So understand that there's omega-3s, omega-6s, omega-9s. And in terms of omega-3s, you want to have the right ratio, which I'll talk about in a moment here. And in addition to supporting or eating foods that are essential nutrients that support the serotonin pathway, you also want to be supporting your liver as well. Now, when I'm working with patients, I'm generally focusing on initially those foods that we want to increase in the diet, ensuring that half of the plate that we're eating is got vegetables, that we are mostly when we're shopping around the perimeter of the store. But there also are some foods to avoid and I want to bring your awareness to those. So first and foremost, aspartame and artificial sweeteners, alcohol and coffee. Are also foods that we want to eliminate or reduce in our diets. We want to avoid foods that are high in saturated fat. So if you just from now on decide that you're no longer going to eat French fries or reduce the amount of French fries that you consume, your body will thank you for that. Sugar is another food, as I've mentioned. So one thing I'll teach you today is when you read a label and it says that say, for example, the yogurt that you're eating, it has 24 grams of sugar in its serving size. What does that really mean? So understand that 4 grams is equal to 1 teaspoon. So in that half a cup of yogurt that you may be having for breakfast, there's 6 teaspoons of sugar if it's 24 grams in the serving size. So keep that visual in mind with the 4 grams, 1 teaspoon. We ideally want to only be consuming less than 36 grams in an entire day. So if you're starting your day off with that amount in your yogurt, that doesn't leave you much. So there's a great little documentary you can watch on YouTube called The Secrets of Sugar. So I encourage people to check that out. Wheat is another problem, and there's some controversy with wheat. There's a chemical sprayed on wheat called glyphosate. So it's questioning around whether it's the chemical piece or is it the actual proteins, the gluten and the gliadin in wheat that are problems for people. These foods like wheat and sugar can contribute to food intolerances in people, and which leads to something called leaky gut that we talk about in naturopathic medicine. So we like to investigate whether this is a problem and a contributing factor in mental health by testing for food allergies or sensitivities. Now, in terms of supplementation, my philosophy is minimum dose for maximum benefit. Now, initially, higher doses may be prescribed. And the analogy I use to explain this is it may take, if we want to get a plane off the ground, we have to give it a lot of fuel to get to cruising altitude, i.e. when you're feeling better. So initially we might need higher doses or more fuel, but then when we get you feeling better, when you're at cruising altitude, we can pull back on that. I find there's a few things people are doing wrong with supplements. So first of all, they're taking the wrong dose. It's always about the dose. So some people, you may not be taking enough of a nutrient to get a medicinal effect. The second thing people are doing is they're taking the wrong form of a nutrient. So a classic example I'll give you is vitamin B12. It comes in 3 forms: cyanocobalamin, hydroxycobalamin, and methylcobalamin. So the forms that are best utilized by the body are hydroxy and methylcobalamin. So check your supplement to see which form of B12 it contains. The third thing people are doing wrong is the supplement may contain non-medicinal ingredients that aren't beneficial. So examples can include sugar and artificial sweeteners, 2 things that I just mentioned that we want to be avoiding in the diet. We also want to be avoiding them in the supplements that we're taking. So this is why it's really beneficial to work with a naturopathic doctor, because we understand A, the dose, B, the forms, and C, what non-medicinal ingredients you want to avoid. The other thing that often arises for patients is if they have issues with digestion and gut health, then you may not be absorbing the food, nutrients from the food and or the supplements. So in some cases, we may want to use IV therapy in that regard, which naturopathic doctors are trained in. And the last point is the dose needs to be individualized based on you, where you are. If you're a 10 out of 10 depressed, the dose that you require is going to be different than an individual who is a 3 out of 10 depressed. In terms of the nutrients needed to support the serotonin and GABA pathways, these are the main neurotransmitters that are involved in depression and anxiety. We want B3, but understand with B3, it comes in different forms. So it can come in the form of niacin, and niacin is a difficult nutrient to take in higher doses. It can cause a flush reaction in the body. So some people think they're having an allergic reaction, but that it's really just what niacin does to you. It causes a release of histamine. It causes your blood vessels to vasodilate. Blood comes to the surface and you can feel hot and a bit itchy. So that's why the niacinamide form is preferred. It's a non-flushing form and is supportive with helping the serotonin and GABA pathways. The third form of niacin is called inositol hexacinate. It's primarily for cardiovascular health, will help with cholesterol, but it's not, it doesn't have benefits from a mental health perspective. Also, with niacin, it can elevate liver enzymes. So if your liver enzymes are already elevated, this isn't a nutrient that you're going to want to start taking. You want to be supervised with a naturopathic doctor on that. The form of B6 that is preferred is pyridoxal 5-phosphate. Folic acid is 5-methyl tetrahydrofolate. So you're going to want to be checking your supplements for these proper forms. B12 I've mentioned, methylcobalamin, zinc in the form of citrate or picolinate, vitamin C, magnesium bisglycinate. Magnesium is another nutrient that comes in many different forms. This is the form that's best for anxiety and depression. Omega-3, as I've mentioned, there's two types of omega-3, EPA and DHA, and you want EPA to DHA in a 2-to-1 or 3-to-1 ratio for anxiety and depression. There's iron is involved in these pathways as well. I prefer the bisglycinate form of iron and also vitamin B2. So when I'm working with people, I like to explain that there's 4 aspects to you as a person. So there's the mental, the physical, the mental, the emotional, and the spiritual. And our Western system is focused primarily on that physical level. And I think if that's all you're going to look at, then you might miss key pieces to the puzzle here. But what I do want you to understand on that physical level is essentially there's 3 macro systems in your body. So I've talked about neurotransmitters, and I've touched on the hormones. So just understand that you have a neuroendocrine system, which consists of a series of glands in your body that produce hormones. And imbalances in these hormones can result in symptoms of anxiety and depression and sleep and irritability. So we really want to make sure that we're investigating whether the hormones are playing a role in your health concerns. And then the last macro system is the organs of detoxification and your immune system. So all of these are involved in mental health. And so when I'm working with someone, I'm trying to establish which of these macro systems am I supporting? Is it all 3 of them? Or is it just the neurotransmitters? Or is it a combination? And then the framework that I'm using to support the macro systems is these 10 steps. So one of the books that I've written is called Beyond the Label, 10 Steps to Improve Your Mental Health with Naturopathic Medicine. So it goes deeper into these 10 areas that I'm touching on today. So understand that the foundation of your health house is diet, sleep, exercise, and managing stress. Then the next layers that we want to look at are your thoughts and your emotions, how you behave and react in the world, understanding the role the environment can play, the role or whether you have a spiritual belief in your life, and then ultimately wrapping everything up in love and compassion for you. Because at the end of the day, it really does come down to how you feel about yourself. And a key question that I ask patients, and as I'm asking this now, answer it for yourself. On a scale of 1 to 10, how much do you love yourself? And if that's less than 5, I'm going to suggest that this is that you start working with someone. Find a naturopathic doctor or a counselor or a therapist. It's really important to build this relationship with yourself, because ultimately you are with you longer than you're with anybody during your lifetime. So we need to get that relationship right. So coming back to the physical level, I just want you to understand that there's many, many root causes to mental health. And in naturopathic medicine, one of the tenets or principles is we want to address what the root cause is of your health concerns. So from the gut brain, there's a gut brain relationship. For myself, I'll just mention that all of my health concerns, prior to all of my mental health challenges starting, I was prescribed antibiotics for acne for several months in my teenage years. Now, I'm not saying never to take an antibiotic, but I am saying, or what I want you to understand is when you do that, you disrupt the balance of the gut flora. You have more than 3 pounds of bacteria in your digestive tract alone. And there's now a lot of research on the relationship between what's called the gut microbiome and mental health. So all of these, from inflammation to poor digestion to decreased detoxification ability and liver health, environmental exposures, these can all be roles in mental health. So understand that there's an explanation for your suffering. And really, it's just a matter of working with a naturopathic doctor to help you figure it out. Now, as I mentioned, I also like to look at the mental, emotional, and spiritual side. So one of the things that I teach is how to manage your mind so you're not at the mercy of it. And there's this approach called what I refer to as the 5 R's of working with problematic thoughts and breaking the thought emotion cycle. So just understand that one of the things that, we get diagnosed, in my own case, I've been diagnosed and been given many labels: depression, anxiety, bipolar disorder. I've been labeled with ADHD, OCD. So that's a lot of labels for one person. Another label we could perhaps open our minds to is that I have a thought pathology. As simple as that. I have a problem with the way that I think. And so understand that your thoughts have a really super power stickiness about them. And these thoughts can keep us stuck around a certain issue or a certain belief or idea. And so we want to start paying attention to what are the thoughts that we are thinking, and are they serving us or sabotaging us? So the first step in this process is to bring awareness to who has the stage in your mind. Is it the inner critic or is it an inner cheerleader? And I can tell you, in my case, it was an inner critic who had the stage pretty much 99.9% of the time. So I've had to learn how to give the microphone to the inner cheerleader. And this is the process that helped me. So recognizing my thoughts and refraining from following them any further if they are along the nature of being critical or negative or not supportive of myself. And refrain from following them is the second step, by then relaxing into the present moment with the breath. The fourth step is to resolve to repeat the first 3 steps every time you recognize your thoughts. And the last piece here is to then perhaps rephrase what it is that you recognize. Now, this was very difficult for me, because if you had just said to me, "Hey, Chris, change your thoughts, change your life," I probably would have rolled my eyes at you and walked out of the room, because I felt like you were implying that I was intentionally causing my depression and anxiety with the thoughts that I was thinking. And I didn't understand this concept of psychoneuroimmunology, which basically means your thoughts affect how you feel. So understand that you have 2 branches to your nervous system, sympathetic and parasympathetic. And at any given time, you can only be in one state. So you're either in a sympathetic or stressed state, or a parasympathetic or relaxed and calm state. And the goal here is to shift you from a sympathetic state to a parasympathetic state. So I'm going through this quite quickly. There is a video that explains psychoneuroimmunology that I have on YouTube. So you can just Google search in YouTube that to learn a bit more. and then start simply. The prescription right now for you, if you're listening, is just to tune into those thoughts and start getting very critical about whether you would speak those to someone you love. If you wouldn't say them to someone you love, then why is it okay for you to say them to yourself? And let's sort of stop that sort of inner bully from continuing within you. So there's many tools to help support your mental health. I mean, these first 5 points really encompass what the 5 R's are doing. But the 5 R's are ultimately teaching you mindfulness, self-compassion. The rephrase step is cognitive behavioral therapy. It's a breathing practice, and I'm helping you become aware of the inner critic. So just understand that these tools can make a big difference in helping you navigate your thoughts. I'll just touch on exercise here as well. It's been said that the most overutilized prescription for depression and anxiety is pharmaceuticals, and the most underutilized is exercise. So just understand that movement is medicine. And for me, this has been a foundational piece of of supporting my mental health. But I know it's hard. I know it's hard when you're depressed. The last thing you want to do is head out there for a walk. This is why it's important to engage an accountability partner or to build in that support for you. And so for myself, I know that, there's been times it's taken me 4, 6, 8, 10, 12 hours just to move from my bed to the door and out. I mean, getting dressed in between there and heading out. But I can tell you that not once have I come back feeling worse than when I went out, as hard as it was to get out there. So I just want to really encourage that movement piece for you. So I'm just going to finish with a case study. So this is a patient, a young woman, 28-year-old, who was experiencing anxiety, depression, insomnia, severe PMS, and then she also had a history of an eating disorder. And so I saw her last year, and she was already taking sertraline, and her scores I use a questionnaire from Mind Over Mood, which is a cognitive behavioral therapy book written by Christina Bjorndal. There's an anxiety monitoring form and a depression monitoring form. So it gives you an idea of the level objectively of the severity of your depression and anxiety. So she was scoring quite high here. So I just added in the nutrients to support that serotonin pathway that I mentioned. So I added in some niacinamide and some B6. She was already taking the magnesium in the form of malate citrate for pain, but I added in the bisglycinate form and prescribed exercise because she wasn't doing that. That had fallen away. From the diet, another book I've written is called The Essential Diet, Eating for Mental Health. So I prescribed that, which includes eating those tryptophan-forming foods that I talked about. There's a seed protocol we use in naturopathic medicine to help support the formation of estrogen and progesterone. So I prescribe that. Water. A lot of people aren't drinking enough water. So just understand that, first of all, if you're drinking coffee, you have to drink 2 cups of water per cup of coffee just to keep you in balance. And from there, you need to then drink a minimum amount is half your body weight in ounces. So for her, she was only drinking 20 ounces. So I increased it to 32. And then encouraged protein for breakfast and lunch. As an aside, I will mention that when I started on this journey for myself, I was a vegetarian. So remember that tryptophan is an amino acid, which comes from protein. So you can do this if you're a vegetarian, but I was not a very good one. I was eating, first of all, there were hardly any vegetables in my diet. And second of all, it was mostly carbohydrates. So again, these essential amino acids are very important. From a counseling perspective, I started with gratitude. This is something that you can start today for yourself if you don't already have a gratitude practice. There's a lot of research around the neuroplastic effect of gratitude. I encouraged her to do something that she loved. She had a lot of interests, but she was not really doing anything to pursue those interests. So we have to build fun into our lives. And then I wanted her to create a vision in her mind's eye of herself healthy. So this gets into the work of Joe Dispenza, who is an author that people can look up if they're interested. So the quote that I'll use to describe what I'm trying to teach here is, what is real was once imagined. So we're wanting to plant the seed in our mind of where it is we're wanting to go and create that vision for yourself. She was experiencing suicidal thoughts. So I just mentioned to her that that is the ultimate problematic thought, right? So when we recognize that, I just wanted her to visualize like a red flag associated with that and to direct her back to herself in a kinder way. Because in that moment, when you're thinking of suicidal thoughts or having suicidal ideations, you're ultimately not loving yourself. So she also was using defeatist language, like, I can't do this, I can't exercise, I can't eat right, I can't. And I just want you to understand that can't is a very disempowering word in Gestalt psychotherapy. It leaves you feeling like you're a victim. And so the quote I like to mention is, you won't get to can by telling yourself that you can't. So be mindful of the language. I also wanted her to check in with herself where she's living. So most people with anxiety are living in the future in a worrisome way. The future does not exist. Neither does the past. The only thing that we all ever have only is the present moment. So use the breath, get back to the present moment, and then affirm what you want to have happen if you're thinking about something in the future. So I prescribed some blood work here. And in the next visit, there still was a lot of stress in her life. Her partner lost her job. But despite that, her sleep had improved tremendously. And as a result of that, she had more energy throughout the day. There was a slight improvement in her monitoring forms here. On the blood work, her B12 was low, her progesterone was low, cortisol was suboptimal. Those are two hormones. If they're low, you can be experiencing mood instability, anxiety. So I built those into her protocol. I added B12. I added a tincture with the JR Nervotine is a herbal formula that contains herbs like St. John's wort, Avena sativa, passion flower. So I added that. I added vitamin D, some progesterone support, and I changed how she was taking the magnesium. I taught her the 5 R's. And then in the next visit, she had significant gains. This patient also is very compliant. So she still was very mild now with anxiety. Normal anxiety is less than 20, and depression, it's less than, I think it's 15. So she was very close to being in the normal ranges for both of these. So, and she had a pain-free cycle, which she hadn't had in several months. So she then, we continued the counseling. I taught her how to manage boundaries and work with that. She's a recovering people pleaser. And then in the next visit, there was a lot of stress. Again, a friend of hers attempted suicide, but she, despite that, remained stable. And in the next visit after that, she was anxiety free. Depression still remained stable and was doing really well. So since then, we've been working on her core beliefs and continuing to shift this inner critic, working in the digestive piece of the puzzle. And I'm going to be revisiting her lab work. So she's doing really, really well. So I'm really passionate about naturopathic medicine. I really think that when people are born, we should be, like in Canada here, when you're born, you get assigned a pediatrician in the Western medical world. But I also think we should be assigned a naturopathic doctor. And I don't think it's this or that form of medicine. I think it's this and that form of medicine. So we take an individualized approach. And we are really trying to address what the root cause is. And as a result of that, it's a patient-centered approach. So there is no other you on the planet. So we want a prescription that's tailored to you. And that's what naturopathic medicine does. And it creates space for these areas that I think are ultimately really, really important, which is love and compassion. This is really missing, I think, in Western medicine. And naturopathic medicine creates space for that. So if you're not already seeing a naturopathic doctor, I highly encourage you to add us to your healthcare team. Or if you're interested in becoming a naturopathic doctor, I encourage you to speak to a naturopathic doctor or contact the schools and get started with that process of inquiry in getting your questions answered. There's nothing not to love about naturopathic medicine. So my future plans, this is a big question. So one area for me that is important to figure out, and I just feel there's not a clear consensus, is how psychosis happens, whether it's in bipolar disorder type 1 or schizophrenia. I have a big interest in understanding psychosis. And so that's an area that I would like to do more research. I've considered going back to school to do a PhD in this, but I'm already 53, so I'm feeling like I may just have to encourage somebody else to do that. And the advice that I have for prospective students, I really wish I knew about naturopathic medicine sooner. And so I really encourage people, if you're a student considering this as a profession, to either work with a naturopathic doctor. That's how it started for me, or to start. Just encourage you to ask questions, get in touch with the schools, and get your questions answered. It's a wonderful, wonderful profession. So I hope that you consider it for yourself. And I think, I guess that's about all I have to say at this point. So if you want to open it up for questions, then you can do that. If you're wanting to contact me, this is my contact information. I'm on Facebook. I'm on Twitter. I don't have the Twitter here, but anyways, I'm on Instagram and Facebook.
Dr. Bjorndal, thank you so very much. So for those of you, if you can just go to the next slide really quick, and then we'll go to Q&A and you can put your info back. AANMC will be having 2 upcoming events. So we have our next webinar is on diabetes, and that is November 12th. And then our naturopathic virtual fair on December 1st. You can see all of the events that we host at events.aanmc.org/events. And if you have any questions regarding the content of this webinar or finding out about the member schools or becoming an ND yourself, please feel free to reach out to info@aanmc.org, and we'll be happy to get you connected. So with that, Dr. Bjorndal, if you wanted to put your contact info or the final slide up, that's fine.
Oh, I'll try to see.
There we go. So that's our contact information if you have any additional questions. And so I will start on a couple of questions for you. But before I do, I just wanted to let those in attendance know that this webinar is not intended for personal treatment. If you are having your own health issues, whether they be mental, physical, or a combination of both, this webinar is not intended for medical care. So we definitely encourage you to see a practitioner yourself. If you are feeling like you are in in danger of imminent harm to yourself or others, please get in touch urgently with the appropriate care facilities that are local to you. There are also national hotlines as well available for those who are having acute distress. So that said, this is really intended as just an overview of how naturopathic doctors work with different mental health issues, and not intended for treatment. So I can't stress that enough. I know there are several questions that have come in from people regarding personal health, and unfortunately, this is not a good format to provide healthcare in. So anyway, that said, Dr. Bjorndal, I think somebody was wanting to see the slide with your contact information.
Okay,
If you can
sorry.
put that, perfect. Thank you.
Oh, goodness. I'm getting a little click
Okay.
happy over here. So
Yeah.
I'll just add to what you said, though, Joanne, that just know that if you're suffering, or if you're experiencing anxiety, depression, suicidal ideations, if you're on that side, just know that there's solutions for you. But the key is you have to reach out and find help.
Yeah, exactly.
So, mm-hmm.
Thank you. So there are a number of different questions about nutrition, and so I know you mentioned caffeine, you mentioned sugar. Some folks were wondering about some natural, quote unquote, natural sugar substitutes like stevia.
Yeah.
And also just in general, caffeine and green tea and coffee and all of the different things. So if you can speak a little bit about that.
Mm-hmm. So, sugar is actually, it's a really big problem. And just understand that the food industry manipulates three ingredients: fat, sugar, and salt, to make you addicted to them. And, I'm going to be the first to raise my hand and say, yeah, I mean, I had an eating disorder, and I had I'm going to say have an addiction to sugar. So you just want to always know where you are, and start with a diet diary for yourself, and then just slowly make changes. My goal here, because I've had an eating disorder, I'm not about all or nothing, but it's about having a healthy relationship to these things. I'm going to be the last, I'm not the naturopath for you if you're looking for a naturopathic doctor to tell you to never have chocolate ever again, because chocolate is something that I actually really enjoy, but I'm not, it's all about the quantity, right? It's really managing that. So you just want to start. A simple place to start is just writing down what you're eating. Just take a look at that, and then see if you can figure out the grams of sugar you're eating a day. That's one thing, and then start to look at how you can make changes to that. There's healthier versions of all of these things out there, and so just start introducing them. I'm still working on my diet, so even though I've written a book on the essential diet, I'm still working on this myself. So everyone's a work in progress. It's not about perfection. It's just about it's really ultimately about how you feel, right? And so if you're not feeling great, then let's take a look at some of these things. There was something else that you asked within the question there, Joanne.
It was just regarding caffeine. I think,
caffeine.
Caffeine is very addictive, and you have people
Yeah.
who are, very much accustomed to their coffee. And so switching can be a big thing.
Yeah. Yeah. So with that,
I think the bigger question, honestly, is how do you address the loss feeling that some people can have when they're taking something out of their diet?
Right. So you want to address the loss by looking at what you're gaining. So it's not that you're losing actually anything. You're actually gaining health, and you're gaining vitality, and you're gaining longevity. These are the things that you gain. And you do these things slowly, especially caffeine. You really want to just do this extremely slowly. But just think about what your body and what your body's composed of. It's not composed of caffeine. 70% of your body is water. So make sure that you're consuming 70% of your liquids should at least be water, right? A lot of people, it's the other way around, right? Yes, I get that there's water in coffee, but there's also the diuretic effect of coffee, which pulls water from you. That's why I said for every cup of coffee, you want to drink 2 glasses of water. So sometimes there's really these basics too that are out of balance for people. And then the question with coffee as well becomes, why do you need that cup of coffee? So is it because you're not sleeping properly? Is it because you're stressed? So understand that coffee causes your body to produce cortisol, which is one of the hormones that can be affected in mental health. So you just want to make a slow transition from it. I hope that helps.
Thank you. You talked about food allergies and sensitivities. Can you speak a little bit to the elimination diet and testing in general?
Mm-hmm. Yeah, so the elimination diet is a great place to start. So if you're going to do testing, if you're going to do food intolerance testing, you actually want to have the foods in your diet. So you don't want to do an elimination diet and then do a food intolerance test, because it may not show up. So before you eliminate foods, you want to, if you're going to do testing, you don't have to do testing. You can just start with an elimination diet. But just understand that what happens is this idea that we talk about in naturopathic medicine of leaky gut. So you want to understand that you're one tube from your mouth to your anus, and that tube should be solid like a pipe. But what happens in life through stress, through poor diet, through medications, through the chemicals in the food, we get what's called gaps in our cells between the small intestine, which is called, and we in naturopathic medicine we use the term leaky gut. So these gaps get created, and then the food particles go through the bloodstream, get into the bloodstream, and before they're completely digested, and our immune system then mounts a response to this. And so that's what gets showed up. That's what gets registered on a food intolerance test. But the issue, so yes, the issue is the food, but the issue is really the pipe as well. Because if the pipe wasn't leaky, then the food particles wouldn't be getting into the bloodstream and our immune system wouldn't be mounting a response. So keep that in mind. It's not just about eliminating the foods. While that can help, we still want to heal that pipe. And in naturopathic medicine, I talk about a 5R approach to that. So remove the foods, repair the GI tract, re-inoculate the bowel with good bacteria, this idea of dysbiosis or the imbalance that can happen with the gut bacteria. And then we want to treat the liver, and then we want to reintroduce the foods. So I can tell you, when I did this, I had to cut out wheat, dairy, sugar, eggs, and chocolate. And remember, I was a vegetarian, and also I honestly didn't know there was any other grains out there other than wheat. So this was really hard for me, really, really hard. But I have never gone back to eating any of those foods to the same degree that I was, in particular wheat. But as I mentioned in the presentation, there's a couple issues with wheat, right? It's what's sprayed on the wheat when it's grown, this environmental piece, but it's also some proteins in the wheat, gluten and gliadin, that can be difficult for people. So it's a matter of perhaps figuring that out for yourself. So I think I may have gone on a tangent there, but hopefully I addressed that question for people.
Yes, thank you so much. So we're getting a lot of questions. I'm trying to keep up with them all. Um, can you talk about the relationship between insomnia and depression?
Mm-hmm. Yeah, for sure. So remember that pathway I showed you, this tryptophan pathway? So the end molecule, or the end, I'll use the word molecule, that gets created is melatonin. So melatonin is your sleep hormone. So often people, when they're depressed, I either see one of two pictures, or anxious for that matter. You're either sleeping all the time, and that's what happens to me when I've been depressed, or you're not sleeping at all. And so there's sort of two avenues to that, and the treatment is different, right, depending on which camp you're in. So what you want to understand is with insomnia, it's really, again, trying to figure out what the root of that insomnia is for people. So what you want to understand is cortisol, which is a hormone, inhibits melatonin production in the body. So we want to definitely be taking a look at the stress piece and understanding, is that playing a role with melatonin production? Or is it people are falling asleep okay, but they're waking up and they can't get back to sleep? So that can be two issues in the body. That can be because over the course of the evening, melatonin is falling and cortisol is rising. And so is it happening? Are you waking up at that time when cortisol overrides melatonin? Or is it because you're deficient in that tryptophan pathway in terms of the cofactors required to convert from tryptophan all the way to melatonin? So hopefully I answered that for you. I should be writing these questions down as you're telling me them because I feel.
That's okay. Thank you.
Yeah.
So there's also some questions about botanical medicine and physical medicine, like chiropractic manipulations and acupuncture. And maybe if you can touch on some of the other therapies that may be used with patients with mental health issues.
Yeah. So, all of the above, basically. Like everything has a role to play, and they all can help. So chiropractic medicine is an important piece of the health puzzle as well, because if you have subluxations and things aren't able to connect and flow properly, then that can be a contributing root problem. So chiropractic medicine is an important piece of the health puzzle. Acupuncture is another modality within naturopathic medicine. So this is why I love naturopathic medicine, because we're like GPs of the alternative world, right? We study, depending on which school you go to, you study acupuncture, you study physical medicine, which includes some chiropractic. I mean, recognize there's a whole profession dedicated to chiropractic medicine. But we really have many tools in our toolbox to investigate what is the root of the problem. Today, I really just spoke about the role of diet and nutrition and the emphasis of managing our mind. But acupuncture, chiropractic, these are all important physical medicines to incorporate, all of which I did in my recovery as well. So I think the key thing here is to also understand that it's not this or that form of medicine, it's this and that, and they all have an important role to play.
Thank you. There was a question on the cognitive behavioral therapy and the book that you used as well. Can you touch a little bit about that and the role?
Yes. The main book that I used is called Mind Over Mood by Christina Bjorndal. And so I did cognitive behavioral therapy as a patient. So I was a patient and I attended a cognitive behavioral therapy program. And then I also took Christina Bjorndal's training in cognitive behavioral therapy as a clinician. So what I like about it is it helps people really look at their thoughts and get really discerning about their thoughts. In what I like about naturopathic medicine, though, is we take it a step further and we look at the connection between your thoughts and then the neuropeptides that get created and then the hormones that get created, which ultimately affect how you feel. So, but the main book that I am familiar with, there's another one by David Burns called Feeling Good. That's another cognitive behavioral therapy book.
There was a question if you were able to put back the slide on foods.
Mm-hmm.
Thank you.
There, the foods to include. Or
yes.
The foods to avoid.
Okay. Foods to include. Thank you. So there are a number of questions that are coming in about becoming a licensed naturopathic doctor and where you can practice and in the US and Canada. We have all of that up on our website. And so for those of you who would like a little bit more information about becoming an ND, feel free to email us at info@aanmc.org, and we can totally get you connected with all of the resources. I'd love to just kind of keep this focused as we have Dr. Bjorndal here on this webinar topic. But for those who have those questions, please shoot us over an email and we'll be happy to get that answered for you. So here's a little bit of a touchy question. So, in Canada, the health insurance is a little bit different than it is in the US. How would you advise people who maybe cannot yet afford to see a private ND? And I will say personally, I have worked on a sliding scale with myself when I practiced naturopathic medicine. So just because you think you may not be able to afford a naturopathic physician, you may be able to if they offer a sliding scale. So that might be a possibility. Excuse me, please. Sorry. Real life here.
I can speak to it as well. So first of all, so the doctor I saw was Dr. Abraham Hoffer. And he, I remember, how did he say this to me? Most of the patients he saw, he worked a lot with schizophrenia. So most of the patients he saw were not working. And his whole goal in life was to get people back to work. Like that, Dr. Hoffer wanted to get people feeling better so that they could have a sense of navigation of their self in terms of this work piece, because we want to be contributing. People want to contribute to society, and sometimes it's hard when we're not able to because of our mental health. So I just want to say that in Canada, we think it's our God-given right that healthcare is provided to us, and it is a really big differentiator between our two countries, between Canada and the United States. But I will also say this. Our taxes are way higher than yours. So we pay, there's a phrase in economics called there's no free lunch. There is no free lunch. We are paying through our taxes for this healthcare system that is supposedly so great here in Canada. Well, I can tell you that I'm grateful for the healthcare system that we have. I don't want to sound that I'm not grateful, because I am. However, the healthcare system is a crisis management system. It's not a healthcare system. So you have to invest in you. The only person who has your back is you. The government doesn't have your back at all. And people think our healthcare system is so great in Canada. There's a lot of problems with it. And I guess what I'm trying to say here is, at the end of the day, we pay for it through our tax system. I know your tax system is different in the United States. So I would just encourage you, if you're not working and you're struggling and the finances is an issue, you can start with simple suggestions like, well, first of all, just shop around the perimeter of the store when you go grocery shopping. You can, like as Joanne mentioned, you can ask for a sliding scale. At any point in my practice, I have at least 3, if not 5 people who I am not charging at all. I see them for free. So there's a lot of practitioners are compassionate, and we will do what we can, to help you get back on your feet and get you, like Dr. Hoffer's whole goal was to have everybody paying income tax. He was satisfied if you were paying income tax, because that meant you had a job, and that meant you were feeling better, and that meant that you were a functioning member of, in his mind, a functioning member of society. So I just wanted to mention that. And sorry if I went off on a little bit of a tangent there.
Thank you. And my apologies for my interruption there.
It's real life, right? This is what happens.
It is real life right now in COVID. So we are just about out of time. I'd love to, if you had anything that you could tell to an aspiring ND or somebody considering becoming an ND that focuses on mental health, or any other specialization for that matter, what would it be? What would you have wanted to hear from as a young student yourself?
Oh gosh, I think one of the things for me is that just understand that naturopathic medicine has such an important role to play, and you can make a huge difference in people's lives. Now, the one sort of difference between me and a lot of the students is I had a business degree beforehand. So understand that at the end of the day, and I really don't like to say this, but the reality is medicine is business. Big pharma is business. You're running a business, and you're in the business of helping people with their health, and there's no shame in that. But learn how to run a business. So when you go to naturopathic school, you're going to learn all about how to be a naturopathic doctor, but you also have to decide which way you're going to go. And the beauty about this profession is you don't have to be a clinic owner and run a business. You can work for you can work in research, you can work for different companies, testing companies, lab companies, supplement companies. You can become a writer. I mean, there's so many different options. You could teach at one of the naturopathic schools. So it's an amazing opportunity and career. And I really think that the world needs more naturopathic doctors. So if you're on the fence, I would just consider, encourage you to just move forward with it if it's possible for you.
Thank you so very much. So that is, I'm going to say that as our last comment. So Dr. Bjorndal, thank you so very much for coming today and sharing your wisdom and your own personal experience with this, with our audience. We're very, very grateful for you taking your time. And for those of you, stay well and stay healthy and mentally and physically healthy during this very tough time. Is a little bit tougher than it might have been 8 months ago or so, but we're all in this, and like Dr. Bjorndal said, we have to be committed to taking care of ourselves because no one else is going to do it. So thank you all so much, and have a wonderful rest of your day, and we'll look forward to seeing you on another one of our webinars. Take care.